Hi, Gypsies. I hope you are all doing well and healthy and safe out there. We have today Darlene Clark sharing her experience in working with COVID-19 in Washington. So, over here is Darlene. So, hello, Darlene. So, she is going to
Hi.
talk about her experience, and I'm going to disappear for a little bit and then leave her room. So,
And I'm Darlene. So I wanted to, first of all, thank everyone for what you do. We wouldn't be able to do this without you. Also, I wanted to thank the Gypsy Nurse team for inviting me on here to do this. So I wanted to talk a little bit about my experience here in Washington, working on the COVID unit. So I'm going to probably take about 30 minutes to go over everything that I have seen and done and been through. And then I'll open it up for some questions if you guys have any. So, first of all, I have a background working on a cardiac progressive care unit, but here in Washington, I float on all the PCU units. I actually first started off working in the emergency department in the inpatient area. And then once the pandemic broke out, I am now strictly working the COVID unit. So, as many of you know, there's been a huge issue with PPE. So I just kind of want to go over that for those who are wondering and thinking about traveling to the Washington area. For PPE, for us, we have bunny suits. They are providing surgical caps and gowns, also cappers. And we first started off with the hospital providing the surgical, or sorry, the scrubs for us. They used the scrubs from the OR, but then they started to get low on the need for those scrubs. So then they just told us to start wearing our own to work. Um, so now everyone is bringing in at least a change of clothes for that are work that's working on the COVID unit. So they'll go to the COVID unit, they'll change their into their scrubs and start working. As far as cappers, we are we are kind of not everyone has a capper basically. So obviously we have to share our cappers. The shields part, when we first started, they did have us use only one, the plastic piece that goes on the capper. They had us using one um, per person for 30 times because they were also in low need of those. After that, we had people in the community that actually, someone, I don't know who it was, but someone in the community made some different piece of the plastic part. And now we have many. So now it's a single use. We can toss it right after we walk into someone's room. Um, let's see. We were on a high restriction at first um, when it came to our N95s, our face mask and shields, and it's starting to become a little bit better now because we've rationed like the rest of the nation, but we are starting to repurpose our N95s. So how that works is we would have um, the nurses come in, they would grab their N95 for their shift. At the end of their shift, they would write their name at the bottom of their N95. It would stick it into a bag and send it down to a processing unit. And so it goes basically into a big bucket, and they would sterilize it, and it would be ready to go for their next shift. So it go down that night, come back up the next day. Um, let's see. I also kind of wanted to talk about um, how we made our COVID unit. So originally it was it was CCU and CVICU. So it was a cardiac unit, and it's on the top floor of the hospital. So within 24 to 48 hours, they basically put up walls and everything that they needed to do to basically block this unit off and make it strictly COVID positive patients. They made it a negative pressure unit. So all the patient rooms all the patient rooms would be negative pressure, and then obviously the hallways would be positive pressure. Um, we There was so many changes, like every single there's even now there's changes every single day. So you may come on the unit one day and be experiencing different things as to how you're going to where you're going to go get changed at to prepare for your shift. Um, and then they would change it to a different place. The reason why it was so many changes, we were considering making our unit the hot zone, so completely just blocked off from the rest of the hospital. And it is like that, but it's not considered a hot zone for right now. Oh, sorry, I am in Washington State. Um, as far as the unit itself and how it's staffed, at first the hospital would just have anyone from the hospital that they could come to the unit, and then they decided to take volunteers. Real quick, just want to say to you guys, I'm going to go through your questions and try to answer them as I can. I am also going to just go through everything that I have for right now. Then I'll answer your questions at the end. Um, so, um, so then some people will volunteer to work on the unit, and then they decided, you know what, let's try to make these same people work on the unit. That way, we don't have new individuals coming in and not understanding how this unit is run and how it's working, because things change on a daily basis, and at least they can have some kind of point of reference, some kind of background. Um, the way that it's run so far, we have been sanitizing everything every 4 hours. So our hotspots are doors that we walk into our patient rooms on, and our cappers, our masks, our isolation carts. Everyone on the unit, whether we're charting or not, we would stop what we're doing and wipe everything down, every surface that we can. Um, we also have runners. We call them clean runners and dirty runners. So we would that means that, like, we would use two CNAs, two techs, um, and one of them will be considered clean and the other one would be considered dirty. So the dirty runners would be able to go into the rooms and help the nurse if they needed assistance. The clean runner would be the one that can go off the unit and run our labs. At the time when nurses could not go off the unit once they were on, they would go like to the cafeteria and grab whatever it is that if we needed, like food or something. Um, let's see. We also we also the hospital as a whole obviously changed a lot of policies. I'm sure that's how it is at you guys' hospitals. As far as since I mentioned the cafeteria, so as far as the cafeteria, nothing is self-served anymore. Um, Everything, the cafeteria staff boxes everything for us if you wanted to go and grab food down there. Um, um, and then also a lot of the tables and everything in the cafeteria area it has been removed because they don't want people congregating in that area. Um, there's also we huddle together on the unit before every shift, and we just can't stress enough to everyone that's working that in a pandemic there are no emergencies. So that means that if our patients, our vented patients, if one of them ended up getting their restraints loose and they're reaching for their tube, or if someone is getting out of bed and they're of high fall risk, whatever the case is, we will not enter that room until we are all suited up in our PPE. No matter what, our safety comes first, which is I've had an instance where one of my patients, he was actually very belligerent and confused, and he was hooked up to so many IVs and heparin and all kinds of things, and we had to protect ourselves first before we walked into the room. We just have to remember that our safety comes first. Um, let's see. A lot of us are bringing 2 changes of clothes to work. Me personally, I'd keep a change of shoes. I've always done this even before the pandemic, but I would keep a pair of shoes in my trunk and another change of clothes in my bag. And they actually allow us to shower at work. I don't do it. I shower when I get home, but they allow us to shower at work before we leave, and then we can change into our clothes. Um, and then I always put my shoe. I bag my clothes, bag my shoes, and when I get to the trunk of my car, I put my new pair of shoes on. And some of us, we even just wear our bunny suits over our clothes, so that when we can doff off that bunny suit, and then when we get to our car, we don't have to necessarily worry about anything transferring over to our cars. Um, Also, I made a contingency plan with the um, my roommates, because when this first happened, I was a little bit nervous because I was hearing that a lot of nurses were being kicked out of their homes. So I went to them and I asked them. I was like, "Hey, are you guys, worried about this thing? Are you thinking about kicking me out or anything?" That's something that I had to have a conversation with them about. So I suggest you guys having conversations with those that are housing you. Ask them, like, if they're worried about it, kind of educate them on it. And then also, you're going to need a backup plan as far as like, hey, should I become exposed? Um, this is the plan. This is what I'm going to do. Like I told them, I will call you if I should become exposed. I'll call you before I come home. That way they would have a chance to set the garage up the way they need. Then I will shower in the garage. We will lay plastic down leading to the restroom. And then I will go into the restroom and again shower in there. And there will already be sanitization items in there, that way I can wipe all of my everything down that I touched in the bathroom, and then I can self quarantine in my own room. Um, and they were fine with that. They appreciated having that conversation. So if that's something that you guys are worried about, then definitely have that conversation with people that are housing you. Let's see. I also got a lot of questions from people that were asking about the trial drugs that are being used. So here in Washington, what I've seen and what I have given, we are all using hydroxychloroquine, which a lot of people are using now. But we're also doing a trial drug called Recivivir. Don't ask me how to spell it because I don't know how to spell it. But apparently I haven't heard of this medication before. But as soon as we the pharmacists, they pre-mix that medication, and then they bring it to us directly because we only have 30 minutes to hang it, and it can run for 4 hours, but we're pushing that medication over 30 minutes to an hour. Um, I'm not exactly sure what the results so far are with that medication, but I do know that you have to qualify to be on that study because I believe there's certain comorbidities that may rule you out from even receiving that drug. Let's see. Also, I mean, there are some good things. I don't want to just, go. I just want to be informative to you guys to let you know what to expect if you're coming to the Washington area. But I also want to let you know there are some good things. Like so far, there's posters hung up in the employee parking garage that I've seen from visitors and patients that are thanking us. There's been food delivered directly to our unit from restaurants and people in the community. And like I said, there's people in the community that are making us face masks. They've made a whole new face shield for our cappers that we don't have to worry necessarily about running out of that form of PPE. And then speaking of cappers, I want to talk a little bit about our aerosolized procedures. I'm sure most of you know what that is. If you're giving one of your COVID patients any dual nebs, any nebulizer treatment, if you're intubating, anything where they're just becoming exposed, we are required to use a capper during that procedure and 90 minutes after, not 30, but 90. The requirement is supposed to be 30 minutes, but we're taking it an extra step and waiting 90 minutes before we can enter that room, or we have to wear a capper before we enter that room after an aerosolized procedure. Let's see. I believe that is, we were, one more thing, and then I will read you guys' comments and see what I can answer. So we have been having, and I'm sure a lot of other people have been having this issue too, but a lot of visitors, or not visitors, but the patients' families that are not allowed to visit, they would call us at, just times where we're really busy and it's difficult for us to respond and give them an update on their family member. So the charge nurse of the COVID unit, they've opened it up for a lot of ideas and things of that nature. And one of my suggestions was to kind of develop a cares team so that, I don't know, whatever they want to call it, they can call it a care team or whatever. But the idea is we would have a team of people that would go around to each patient, or kind of like a care management, call that family, discuss a time that would be better for them to be able to call and talk to them. And they can give them updates, and they can also do like a FaceTime with their family. A lot of our patients are vented. So I actually had a husband on the phone the other day. He really wanted to just pray with his wife, even though she couldn't talk. I was able to put the phone up to his ear. But if we were able to develop a separate team for that way, it will not take away our nursing care and provider care during those times, because as you all know, it's very hard to don and doff off your PPE and go into that patient's room, do that, and then have to also make sure everything is okay with the vent, make sure everything is okay with just your other patients in general. And like I said, I am a PCU nurse, but I have actually been taking ICU patients, which I have a background as a paramedic. I've been working prior to nursing 7 years as a paramedic. So they did request for our strong PCU nurses to be able to take some ICU assignments as well. All right, I am going to start going through you guys' questions and see what I can answer. All right, I told you, okay, so I'm right now I'm working in Washington. I just answered that I am working, I actually work, I'm a PCU nurse, but the COVID unit, we split it between PCU and ICU, well, any COVID patients. So, but our ICU patients are all on one side, and then on the other, in the other hallway, it's med-surg PCU patients, COVID positive patients. Thank you, Monica. How this? So, Amy, my agency has actually been very supportive during this time. I work with TNAA, my recruiter, Ashley Hazen. She calls all the time or texts me, make sure that I'm okay. They've been very extremely supportive. I'm very grateful for them. Thank you, Lori. Yeah, runners do help a lot. I don't know how we would be able to do it without them. By the way, too, as in regards to how the unit works, they have limited care. They have limited access to other people from entering our unit, like cafeteria staff. For our patients who are not intubated and still able to eat, they would leave their trays outside of the unit, and then our runner would grab the tray and distribute them as they can. It's sometimes hard to get lab up there, but I mean, we'll draw our own labs. That's not a big deal. I've had a little bit of pushback from PT, OT also, which, I mean, I understand. Let's see. Thanks, Ashley. Hi. Okay. Remdesivir. Yes. What? Use in California. Yeah. Thank you, Harry. So I see like see some comments about like pay. So guys, I actually extended before the pandemic. And because I extended before the pandemic, they are not offering nurses that were already here prior to, they're not offering them any crisis pay or increase in pay. However, they are offering crisis pay to new travelers to this area. So the multi-care system, they are offering crisis pay to new travelers to this area. Also, I believe Harborview and St. Joe, which are in need. And then there's also a need in Spokane. Thanks, Tina. Yes, we are proning our patients. I actually posted something about that the other day. I was concerned that we weren't proning them early enough. So I actually posted in the Jitsi Nurse group, and I asked if anyone else was proning their nurses. I got basically is to prone early as possible. Unfortunately, what I've seen here is that we have not been proning as early as we should be. But with the patients that we have been proning, we have been getting great results out of them. It's a lot of our intubated patients that we have been proning, though. There are a few people that we've proned more like 3 times already. And I believe what's factoring into their issues is comorbidities and age. And then as far as age, I've seen the youngest patient was in their 30s here so far. That's not doing well, but that I think that we should be proning a lot earlier. I've been told that if even walking, talking patients and people at home, if you're able to prone, or if you're able to give out, tell them to prone, then tell them to prone. Tell them to sleep laying down if they can, if they're able to handle it. What that does is expands, you guys know what it does, expands your lungs, helps to get air moving better. Let's see. Patient ratio on the COVID unit, so far we've been actually pretty good. So PCU med surge, they get their 3-to-1 ratio, and ICU is anywhere from 1-to-1 to 1-to-2. If they're prone, obviously they're a 1-to-1. We are actually practicing team nursing. So what that is we'll do like ICU nurse, PCU nurse, and a med surg nurse to a couple patients. So they're all taking care of the same patient. And that way it takes the burden off of that ICU nurse to be able to care for other people that are not doing so good. And let's see. So like I said, it's not that bad. When we first opened up the unit, it was pretty bad. Our ratios were not great, but we figured some things out, and just, gosh, those nurses in New York, thank you, because man, it's man. Let's see. Chill. Thanks, Chelsea. The recovery for those that are vented, I honestly, I haven't seen a patient come off the vent yet, but I've heard that some people has come off the vent that have been vented with COVID. One of our young guys, I was actually, I didn't think that he was going to make it because he was not doing well, but we proned him, and we proned from anywhere from 16 to 18 hours here. So after we proned him, he's doing a lot better. Yes, Tara. No, yeah, Harry, we are definitely getting COVID patient. There's a lot of travelers on the COVID unit, and then some staff from the ED is also they're coming up to help as well. Providence, yeah, you've seen a lot. Actually, I've only seen one patient needing dialysis that had COVID, and they were not doing well. I'm not sure how that turned out. RT is doing the intubations, RT or anesthesia. It's not that bad here yet, where they're having, or any CCAs, they're doing our intubations. Yeah, I am caring for myself mentally and physically. I am a spiritual being, so I kind of debrief. I debrief with myself before I go into work, and then afterwards as well. And then when I'm home, I make sure that I am not like watching the news 24/7 like a lot of people, or I exercise as much as I can. Actually, the other day, and I had a long, hard shift, and I didn't want to work out, but I ran 2 miles after work, and it helped so much. Like, it just helped so much. So definitely just continuing to stay on my own routine, eating healthy. It's so easy to just like not even just like a lot of nurses, even before like the crisis, we don't eat healthy sometimes. I mean, it's hard to. You're tired, you're running around, you're caring for other people. But if we don't care for ourselves, then we're going to end up needing to care of ourselves. So the first 48 hours not using high flow. That's interesting, Harry. Let me know how that goes. Um, Tina, I have seen some healthcare workers become infected, not any that I personally know myself, but yes, some in the hospital have been, but I'm not sure how, I'm not sure if, you know, it was because of caring for a patient or other things. Jeez, Kelly. Well, thank you for all you do. That's a lot. Wow. I do have a question for you since you're in New York, Kelly. Are those patients um, that you're seeing, are they older? And I'm sure they have a lot of comorbidities too. Tara, I'm in Tacoma, Washington. I'm working at Tacoma General right now. And then I have another one of my nursing friends. She actually just went to work at Harborview, and I have another one that works there as well. And that Harborview is a level 1 trauma center. It's actually based on Grey's Anatomy. And then Tacoma General, we're a level 2 trauma. Okay. Yeah, Tina, is very interesting. And so they have these like rotator beds to prone patients here, but we haven't even been using them. We've just been proning them. We will use a total of 7 people, so RT at the head and 3 on each side to prone the patient. 3 sheets, 3 double stuffed pillows, and at RT's count, we'll do 1 turn at a 90-degree angle, and then in the last turn to prone them. The patients that I've seen so far, they're actually anywhere between 40s to 90s. Actually, I've seen 90-year-old patients, but the ones that are the sickest are patients with comorbidities, as well as let's see, I told you the youngest I've seen was in their 30s, and I don't know, just between 50s and 70s have not been doing great. So it's kind of, the thing is about this virus is that it is it just varies so much in different people. It's hard to find out what's really trending with this virus. Um, I've seen people who has a ton of secretions, and then I have seen people who with no secretions at all that are intubated. So it's really hard to see what's really trending. Okay. So I don't know, how long have I been on here for? Yeah, it's been about 30 minutes. Yeah. So Tina, the patient is laying face down. Um, the neck, they'll be laying, their neck will be laying to the side, usually towards the vent. Um, and we put them in the swimmer's position, so one arm up, the other arm back, and that's how you continue to rotate your patient during that time. Um, Obviously, you get your Alleviant to relieve pressure on those pressure points. So we do shoulders, hips, knees, and also the tops of the feet. Wow, that's awesome, Carl. Carl. Oh, Carol. Sorry, I'll call you Carl. Carol, thank you. Uh, Actually, my family, they're handling it just fine, I believe. My I was actually, concerned about my mom because she's immunosuppressed, but she's doing just fine. I do. It's it's great that I'm able to talk to them and let them know what's going on. It's just hard being like away from them. Like a lot of people are quarantined at home with their families. So, even though they're away from other people, they still have their family. And like I'm out here by myself, just me and my dog. So that's been a little tough. A lot of phone conversations. All right. Thank you. Thank you all. You guys are working so hard. Um, so, I mean, if you're considering coming to Washington, just expect the things that I just mentioned. Honestly, Tacoma General, they've done a great job of um, with everything that changes every day, and they're taking suggestions from their staff and not leaving anything out. Um, they know that it's a work in progress. So if anyone has any other questions, let me know now. Otherwise, thanks, Sam. um I have not had, I guess, issues with charting so far I mean, honestly, even before COVID, um, I don't know. We use Epic here, and the hospital I worked at before. I used Epic, so I was like I was good with the charting system. Just certain things that they want you to be able to chart on, like obviously pain and like things like that. But working with a COVID unit, they know that we are busy. They know that if we're going to go into the room, we're probably going to be in there for a very long time, and time gets away with us. So chart on like the big things that you can while you can, and chart put a note in there if you can. If you can't timestamp it, then at least put a note in, and you can always go back and chart afterwards. But I haven't seen anyone really stay late for charting unless we had a turn of events prior to shift change, which that has happened a couple times. But they are very understanding in that area. Okay. All right, and guys, you can like continue to leave comments on here, and I'll just go through and answer them. Um, I'll answer them via text or whatever. Other than that, I think I'm going to get off of here and end this. Again, I just want to thank you guys. I want to thank the Gypsy Nurse for letting me come on here to share my experience. Just remember, guys, it's a team effort, and protect yourselves first. Do not put yourself at risk, because you see how bad it is right now. So you don't want to be risking your lives. I know we're superheroes and we like go after it. We run towards danger, but you matter as well. All right. All right, guys. I will talk to you later. I don't know if Rachel wants to come back on, or
yeah, thank you.
Give some time to see if she does.
I think I'm back. Hi. Thank you so much for coming on and sharing your experience. I'm sure everyone appreciated, giving you that honesty and, giving all of your inspiration and information and all that stuff. So, please keep out there, get and thank you for watching.
Thank you.